This is Mountain Health Minutes. I'm Ted Owens, your host, and I'm speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, so good to have you.
It's great to spend time with you today.
Harry, we've talked about this in the past, and that's seismic regulation on hospitals. This is all hospitals on the California side, but the regulations keep ramping up. What can you share with us today?
It's really important for our residents and visitors to know that only in the state of California, there are significant seismic requirements relative to every building that's involved as a part of a hospital in or outpatient structure. And we have a huge deadline that's coming up January 1st of 2030.
Harry, some of the challenges isn't just getting the construction done, although that is a huge challenge. It can be for rural hospitals very daunting in terms of the ability to even afford it.
Correct. Not only is it difficult to find the skill set contractors, but for us in our area, the construction costs or remodel costs are 2 times what it is in San Francisco or other expensive areas. So it's a very formidable challenge.
These are very extensive requirements. One of the newer ones that most of the public probably is not aware of has to do with water, power, and the ability to store sewage after a particular event. What does that regulation look like?
As a part of the seismic regulation, we are supposed to be a surviving and functioning city, if you will, when everything else around us is no longer functioning. And that means we have the power, independent power. We have an adequate supply of fresh water, several days of fresh water. The price tag of all of these components is significant.
Not only that, but storage of water and sewage. Have you got the room on your campus?
It's going to be extremely challenging on a small campus to maintain the water and the sewage capacity when we consume 1,000 to 2,000 gallons of water or sewage an hour.
Well, I also understand that there may be some relief legislatively, but we've seen that before, have we not?
Correct. We're hopeful the regulations could be delayed a bit. Again, these are regulations only on California hospitals. That would be great if they could be deferred a few years.
Great. This has been Mountain Health Minutes. We've been talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, about upcoming seismic requirements. Thanks very much for listening.